From the WDXY studios in historic downtown Sumter, At Your Service Home Care presents Medical Forum with moderator Jeff Reed.
Good morning on this Saturday morning. I'm your host, Jeff Reed. Welcome to Medical Forum. My co-host, Chris Marr, Dr. Chris Marr. Chris, how's your week?
It was good.
Was it good?
It was a good week. Looking forward to a little football this weekend.
Gosh, I know. Last week with Carolina, I'm still...
There's a lot of sad faces in Sumter this
Yeah.
year.
I mean, kickoff is probably an hour and a half away. So hopefully the Gamecocks, I think, will be fine with Central Florida. I'm sure your office was elated with Dr. Louder and Clemson.
Yeah, that was a
beating
good game.
Louisville.
Beating Louisville. Missed that field goal in the last, what was it, about 3 minutes on the clock?
I don't know.
It was
I'm so tired
it was a
of
good
Clemson,
game, battle
man.
back and forth.
It was great last week's show having Timmy on here, and very interesting with the golf tournament coming up, and then what the foundation does with, and you know what, we talked about it last week. Christmas will be here before we know it.
Absolutely. And Kim Price is gearing up for her decoration of the Christmas tree.
Yeah, I appreciate your prayers for her last week.
I'm hoping they're going to get her some sort of system to keep her on the ladder this year.
Well, luckily all right, for those of you who missed the show last week, Kim Price was on here talking about all that they do with the hospice and the foundation, and up until last year, they were putting a 30-foot tree on top of a 30-foot building, and she was decorating
gift shop.
The gift shop inside to me,
in the lobby, yeah. And she said she's decorated on top of the gift shop for several years. Right.
Now, she did give fall and Les Thompson a little bit of kudos for helping. However, but I appreciate your prayers that you extended out to her that if this is her last, which might be decorating the tree without a harness, we wish Kim all the luck in her family.
All the best.
But hey, we appreciate everyone every Saturday morning from 10 to 11. And, of course, we re-air from 2 to 3. We hear and we talk about all the medical issues in the show's Medical Forum. We reach out to Florence. We reach out to Clarendon. We reach out to Kershaw. And, of course, the great city of Sumter. And today we have as our guest Miss Tina Dinkins.
Hello.
Tina, how are you doing?
I'm doing great. Thanks for having me.
Well, we're delighted to have
Tina
you.
came all the way down from Columbia today.
Yeah, but I've
made that trip.
I've been a mainstay here in Sumter
She
recently,
has.
So.
I've seen her a lot
pinch
on the
hitting in Sumter.
Yes.
Well, Tina, what we try to do here in the first segment is not only do we want to talk about all the great things going on with MSA, but we also want to get to know you. So, Tina Dinkins, give us your titles, maybe a contact number, talk about anything personal and how long you've been in the business, and just let our audience know all about you.
Well, I was born and raised in Columbia. I've been in the healthcare industry. It sneaks up on you, and every time I say this number, it gets catches me by surprise. Almost 20 years. So doing anything from home health care to infusion, pharmaceutical sales. I've pretty much done the gamut as far as anything to do with healthcare. I enjoy helping people, and I care about getting people what they need. And that's really kind of my drive and why I've been in the industry as long as I have.
Very good. Now, what's your title at all right, because there's so many branches to the company that you work with, I'm familiar with as MSA, Medical Services of America.
Correct.
And then inside of it, we have Tri-County Home Health and Hospice. We have MediHome Medical Equipment. So as you spoke about the gambit of all the things you do, what is your title and which company you're affiliated with the corporate, correct?
I am at the corporate office. I started a new program with the company about 4 years ago, and it kind of just happened when Obamacare came out. We kind of saw a need, and I got the finger pointed to me and says, go do it. Didn't have a game plan, but actually it's called Resource Links. I'm the director of Resource Links.
Okay.
And what we do is help patients, help actually physician practices, because of all the healthcare changes and what has to be documented to get it, actually assist them in getting the needs that they have.
we talk about that on the show, Chris, all the time. In fact, just a short plug, next week we have Karen Schwartz on, which I mistakenly said that she would be on this week, but sometimes I'm just not very smart and don't read my calendar very well. But she will be on, and she is with Bynum Insurance, and they talk about the Affordable Care Act, as you've alluded to, Tina. So there are so many changes, and one of the things that Chris and I talk about, back 5, 6, maybe 10 years ago, there was the red, white, and blue card for Medicare.
Correct.
And now there's all these other subsidiaries out there. Is this what Resource Link is? One of the availability things that they do is to try to vector through some of all these changing Medicare and HMO?
Yeah, and most of them follow Medicare guidelines. But the thing with Medicare is it constantly changes for these patients. Just because you qualified for diabetic shoes last year, you may not qualify this year. Mm-hmm. There's certain little tweaks that they made to save money. And then we have to make sure that there's other documentation, that the patient has certain types of disease states to qualify again. Getting a wheelchair, you just can't write a script for it and hand it to somebody and they go and get it. You have to have an office visit with a physician. They have to explain why they're giving you this wheelchair and that they're ordering the wheelchair with footrest.
Right. And what you're talking about there, the riggings that are associated with that. Dr. Mari, you could probably chime in on this because, many times you will call my office or you'll call MediHome and you'll say, okay, the patient, I want them to have a wheelchair. They need a wheelchair for these reasons. And then we come back with, okay, here's what we need to see, as Tina's saying in the notes. So you see that all the time.
Absolutely. It creates a significant amount of work for everybody. And some of these programs have really helped the physician practices deal with this increase in paperwork and making sure that all the criteria, the T's are crossed and the I's are dotted.
Right. And we actually go an extra step. We talk to the patients and explain what's going on in the Medicare world because they have no idea that these guidelines have changed. They haven't changed health-wise, and they don't understand. So we actually go and we actually talk to the patients, explain it, and, if they have any further questions, we try to assist them. And then also, other things come up when you're talking to a patient that they may not have thought about asking their doctor. So we can go back and say, hey, her home health nurse said her SATs were low. Next time she comes in for a visit, you may need to check that as well. Right. So we're finding some needs on top of helping and guiding the patients to get the services and helping them understand it better.
Well, what that also helps, and we've had, obviously, Toomey Hospital on, we've had Clarendon Hospital on, and one of the biggest trials and tribulations they're going through is trying to avoid readmissions.
Absolutely.
So what you guys do, Tina, is that you're able to say, okay, the patient here needed a wheelchair, but as we really drilled down into diagnoses and such like that, you know what? That patient has CHF or COPD, congestive heart failure and such like that. So you really need to consider oxygen. And there's a simple test that your company can do, doing a pulse oximeter, and your company will go out, do that, do an overnight pulse oximeter. So sometimes those signs that we see in a perfect environment, whether in the hospital or in Dr. Marr's office and such, we find when they get home that they need that. And we come up on our first break. We want to thank Tina Dinkins from Resource Links through MediHome Care, MSA, Medical Services of America. And as we come back, we'll talk about all the things that encompass Medical Services of America.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When you buy home and car insurance, you'll receive a multi-policy discount. And when you buy life insurance, you'll get a special discount on your home and car insurance. Auto Owners will save you money on all of the insurance you already have. Now that's good policy. This is Sandy Wilson with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
At Your Service Home Care provides in-home personal care, including light housekeeping, bathing and dressing assistance, medication reminders, meal preparation, companionship, transportation, and assorted other assistance to continue living safely and comfortably at home. At Your Service Home Care works with your local home health, hospice, Alzheimer's and VA programs, and other providers in the Sumter, Clarendon, Lee, and surrounding areas. Locally owned, At Your Service Home Care is here to ensure you and your loved one continue to live your life with dignity and respect. At Your Service Home Care, 1250 Wilson Hall Road, Sumter, 803-607-9677. Please call, stop by the office, or visit www.ays-homecare.com and let them know how they may be of service to you and your loved one.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
This is Medical Forum, presented by At Your Service Home Care.
And we're back with Medical Forum this early Saturday morning. Remember that we re-air on Sunday at 2 o'clock. And Jeff and I have always talked about the importance of staying local, using local services in Sumter. We have such a variety of great, fantastic vendors in Sumter. Any from our sponsors like Bynum Insurance and Toomey Healthcare, to the fantastic services over at Reliable Medical Equipment over on 246 Broad Street, Sumter, South Carolina. The phone number over there is 934-9212. You know, there's a trend in medicine now. If you watch on TV, a lot of companies, national companies, are trying to sell our seniors a lot of medical equipment.
A lot of orthotics.
Shoulder braces, knee braces, back braces. I was watching TV this weekend. I was watching some football, and I was amazed by how many commercials there were. I have patients who are bringing these forms in all day, every day. And I even have patients who are saying, I didn't know anything about this. I'd never asked for a knee brace. And they're sending it to them. So I've educated my patients about obviously not sending anything back until they've talked to their physician about it. But more importantly, how important is it to properly measure patients for this equipment? And sometimes a small doesn't always work for a certain knee, a medium, a large. And so at using local vendors like Reliable Equipment,
and MediHome as well.
MediHome, MSA Services over on Boltman.
Correct.
There's someone there who is going to fit that brace to you.
Yeah.
And the bigger issue is when that brace is a problem, you take it right back and it's fixed.
Exactly.
Well,
that's what I tell my patients as well. Deal with somebody local.
Right.
These companies that you're maybe getting your diabetic supplies from now are going to be faxing the doctor's office all this stuff, but they're not local. They're in Florida. They're in California.
And you know what? Most insurance, Tina, you'll probably echo this, especially on diabetic shoes. You can get diabetic shoes once every year. This back brace, just using that as an example, you might not be eligible for another 5 years. So once they bill it, now when you have to get one that accurately fits you, unfortunately, that might be cost for you. So I like the commercials only in the fact that it does allow people to understand that there are options out there if you have back pain and you're wondering if it's something that can be covered. However, companies like Reliable Medical Equipment, Home Care, people that can handle those orthotics and diabetic shoes and any of your equipment, stay local because something's going to happen. A wheelchair has to last 5 years. My goodness, is it really not going to need some assistance? So stay local. We always preach that. And, you know, Tina, with one of the things, your company's been here for years and years and years and always been a staple in the community through both the home health, the hospice, and the durable medical equipment that you supply. And now, for those just joining us from the beginning of the first segment, resource links, something near and dear to your heart that you've kind of tag team with some individuals at MSA that allows the seniors the ability that when they're in the doctor's office to be able to have a liaison, that when the physician, because there's so many people that need to see a doctor, and the doctor sees them and they want to see everyone, right? We see what's the slogan over there at Colonial there, Chris?
Yeah, we'll see you today.
We'll see you today. So to be able to do that, we need people like Tina and her fine staff that are inside the facilities, because there's a lot of questions that come up. I mean, to be quite honest, you're more experts in this, Tina.
Absolutely. And the doctors, they're there to help diagnose the patient and treat the patient. And, it's getting tougher and tougher. They're having to see patients in such a small period of time to get in and get out. And we offer that extra assistance for the patient to understand what's going on in healthcare. I mean, even if it is about the facts, we get those questions every single day. And one of the practices that we're in, they actually hand us a stack of them, and we go through them for them, because we know, we know this patient, and we'll call the patient and say, I'm a representative, and we received this fax. Did you order this? Are you aware of this? And then most of the time, 99.9% of the time, no, I did not know anything about this, that my diabetic company sent me, to get a knee brace and a back brace. And we're like, well, if you have any issues, you need to schedule an appointment with your physician, because for any type of equipment or anything that you need in the home health arena, you're going to have to see a physician for, and it has to be documented.
Where will you see that, Tina? That will be inside the doctor's facility, where they come in maybe with something that's been sent to them, or looking for the physician to sign off on something. And this is for the people, just so we can understand, when we're talking about something that's going to be attached to your body, and knee brace, diabetic shoes, anything for your shoulder, your leg, what have you. This is somebody over the phone who has not seen you physically, looked at you. Do we have edema? What kind of medications are you taking? It's ridiculous.
It goes one word. It goes even further that when I come into my office in the morning, I have multiple faxes on the fax machine for these sent in directly to my office. And this is a huge liability for myself. If I were to sign these haphazardly and send it back, that's Medicare fraud. That's fraudulently billing Medicare. And so there's stacks of them sitting on my fax machine waiting every morning.
Well, Tina, back on what you said in the first segment with Resource Link, it used to be that you didn't have to see your physician. And I know some people that are out there who have dealt in the Medicare environment for years now are sitting there going, I need a wheelchair. Well, I'll just call my doctor and say, look, my knee hurts, or mother's knee hurts. Dr. Marr, please just write me over a script and I'll stop by and pick it up, just like I do for a medication. They have what's called face-to-face now. And it's because of this environment that you spoke of, because what we're talking about here is Dr. Marr has to look and say, before I'm going to take your insurance and I'm going to make them pay for it. Sometimes we think that nobody's paying for this. This is insurance. And insurance is coming from taxpayer dollars and Social Security in some cases. And you're talking about, I need a wheelchair. Dr. Marr has to go through a checklist. That's where I think Resource Link has been a great ally to the physicians.
Yes, absolutely. With all the changes, we're able to say, yes, this patient does qualify, and we can walk into the room with the physician, or if Dr. Marr can say, hey, he's got MS, it's in the early stages, yes, he's going to qualify. One
of the biggest changes we've had in years, just in my 12 years of practicing medicine, the motorized scooter.
That's a sore subject for Tina and I, but go ahead. If you want to take the dagger out, go ahead.
I'm going to put the dagger in, but what a mess.
Are we going to talk about the two ladies going to the Grand Canyon, or are we going to talk about the guy that if Dr. Marr didn't sign it, we'll sign it anyway, So.
It was, that's been quite a mess over the past 10 years. I mean, when I first started medicine, you signed the form, and it was just a given. And now the process to get that type of medical equipment is
very
a
arduous.
Physician visit, physical therapy visit.
Dr. Marr, I want you to hold that thought, because that is a very, very big question that people in the arena that Tina and I play in constantly ask, why can't I get this done? And we can explain, and I want you to explain it more depth as we come back So you're listening to Medical Forum. Thank you all on this Saturday morning, and we'll be back right after this message. We're going to talk about these scooters.
We'll be back with Medical Forum, presented by At Your Service Home Care on Sumter's home for news, talk, and sports. WDXY 1240 AM and 105.9 FM.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When you buy home and car insurance, you'll receive a multi-policy discount. And when you buy life insurance, you'll get a special discount on your home and car insurance. Auto owners will save you money on all of the insurance you already have. Now that's good policy. This is Karen Schwartz with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
I was Daddy's girl. He was my guide, confidant, and friend. We cooked out, fished, and talked about everything. He has trouble remembering those times now. I'm the parent and caretaker to my dad. He does remember losing his dignity each time he needs my help with simple daily care. Calling At Your Service Home Care was the best thing I've ever done for my dad. His personal attendant provides assistance with bathing and dressing, a compassionate presence for his safety, and even travels with our family. Having At Your Service Home Care working with me now gives my dad his dignity, and I can enjoy just being his daughter again. The wonderful people with At Your Service Home Care have the gift of caring for your loved one. If you have become the caretaker to a parent like me, contact At Your Service Home Care, 803-607-9677. Located at 1250 Wilson Hall Road in Sumter, or visit the website www.ays-homecare.com.
This is Medical Forum, presented by At Your Service Home Care.
All right, we're back with Medical Forum on this Saturday morning. This segment's brought to you by, and the show today is brought to you by At Your Service Home Care. Your guide, your steward, your concierge is waiting for you for any home health issues that are needed for loved ones, family members who are not interested in leaving the comforts of their home, not interested in living in a facility. We can send attendants out to the home, keep them comfortable, take care of all their needs. Each client has their own concierge who is available to them for all their needs. Call At Your Service Home Care. The number is 803-607-9677. Also located 1250 Wilson Hall Road.
So local again.
Local again.
Love
Stay
it.
local. And
we've used the service. It can work in conjunction with your typical home health and your hospice services.
Yeah.
And it's such an added value. And we really had great results from
Correct.
it.
It really is. Great people over there. Give Christy a call. You'll get a pleasant voice, and an old Sharon will lighten your day up, even if you just have some questions. And you know what? If that's the option for your parent or for yourself, you got to get back to work. Someone needs to take care of dad, and you want to have that comfort of knowing that they're being taken care of. Give them a call, and if it's not the right situation at that point, they'll point you in the right direction. So At Your Service, thank you so much for sponsoring the show. And when we left, I think it's a subject to talk about, Tina. You and I at the break had a very animated, because we play out of the same pool of water here a little bit, but we were talking about mobilized mobility, specifically power chairs and scooters, more familiar in terminology, but motorized power chairs. And we used to see a lot of them. Dr. Marr used to see a lot of them come in, and it was fairly simple paperwork and such. And I think what Tina does with Resource Links is that utilizing that piece of equipment be a great way to really hammer home the value that you bring to the physicians. Because for years and years to have a power chair, and for those of you who maybe had a husband or a mother or what have you that qualified for a power chair, it was as simple as bringing in a piece of paper and answering about 6 or 7 questions by someone like Dr. Marr.
It was a very short evaluation, went through a couple of things, and made sure the patient met a few short criteria to qualify.
Well, and you know, it's like
12 years ago. 10 years
well,
ago.
you know, maybe what do you think,
maybe
Tina?
even up
6
to
years
6 or
ago,
7.
maybe?
Probably 6.
Yeah, I think
would
that's a good number.
Kind of closer, or say 5, would meet in the middle. But yeah, it's changed tremendously. It is a very arduous process.
And let's call a spade a spade. And if anyone's listening out there that takes umbrage to this, they know how to email us. But we had talked earlier in the segment about the television. And television is a tremendous resource to educate. It is a very poor resource to order things off. And now the theme is the orthotics, from knee braces to back braces. Tina, back as we alluded to 6 years ago, you could not watch something in the middle of the day without being interrupted by a scooter store commercial who implied that if Medicare doesn't pay for it, well, you can have it. No. Somebody pays for it. Insurance is real money. It just happens to be in the source of an insurance. Or the 2 young ladies going to the Grand Canyon, as we talked about. You know, a power chair was made to help people in the safety, to be safe inside their house. Correct, Tina?
Correct. Medicare guidelines actually states in the home, to be utilized in the home. So that was so misleading.
Correct me if I'm wrong.
Okay.
It has to assist them performing activities of daily living.
Correct.
So a patient who cannot perform these activities, meaning truly they can't survive on their own in the home without this equipment, are the patients who now are suitable for it.
And there's a lot of people that needed that inside the house that then also were able to have the luxury of having a van or a lift that allowed them to go to the grandson's softball game or go to the mall or go to the grocery store. But the primary focus. So as we talked about, Tina, and maybe you can talk to us about Resource Link, and because I'm sure you have this discussion certainly on a weekly basis, if not on a daily basis. Used to be, as Dr. Marr alluded to, 5-6 questions. Criterion was laid out. I don't know that the criterion so much has changed. What has changed is the breadth of information and the depth of information that must be in your notes and the series of other questions, and they're holding people a whole lot more accountable. Tina, talk about that.
Actually, you go into the doctor and you say, hey, I would really like to get a scooter, power wheelchair, whatever I qualify for. And usually that's when I'm called in and I have a conversation and let them know, okay, what has to happen next is you have to have a physical therapy evaluation. We have to see what your functionality is, what your range of motion is. How many steps can you walk? Are you getting out of breath? It's a very long therapy session that you do. It's a one-time thing. But then you also have to come back to the physician's practice and have a face-to-face. And the primary reason stated on that visit has to be for a mobility examination. And then he has a full page to cover as far as criteria is concerned, ruling out a cane, ruling out a manual wheelchair, ruling out a walker, a walker with a seat. If you can use your arms, you're going to be able to push a regular wheelchair, and that's what Medicare is going to pay for.
Well, in addition, he's got to go to the house.
Absolutely.
Because now, after we've passed all that, if we walk into a place that doesn't enable him to get in there or doesn't have, and correct me if I'm wrong, Tina, the ability to utilize it then safely or effectively in the house, then that's strike, and all we need is one strike.
That's it. And then there's a home evaluation that has to be done. On top of that, once, we get to a certain point, we have to go into the home, measure the doorways, and then we have to make sure that they can use the equipment that they've been given if they do qualify. So that requires a couple of more PT visits. Usually the PT will go through them, or the ATP that works for the company will kind of go to the house and see if they can maneuver it and do it. And if feasible for the home, like you said. So it's very, very long process, and some people have spoiled that. But again, it is to utilize in the home to help them with their daily activities.
Well, and let's throw one more curveball as we close up this segment, and then we'll move on to all the other things MSA does. It's now a cap rental. Now,
Yes.
for those of you out there, that terminology may not stick at home, but we have two types of equipment when we deal in medical equipment. We deal with a purchase, a walker, a bedside commode, and such. We have cap rentals, a hospital bed, a wheelchair, because if you're not utilizing a CPAP, if we find that you're not utilizing it, that's part of Tina's responsibility to your company, then is to make sure that they are utilizing it. So a power chair now, it's not owned by the person until after a 13-month qualifying. So for all of you that have one and you're used to going out and unfortunately the patient might pass away that needs one, don't sell it in a trader like we see so many of them. But we'll be back right after this break, and we'll continue to learn more and more about Medical Services of America with Tina Dinkins.
Back with more on Medical Forum, presented by At Your Service Home Care.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When your policy comes from us, it comes with something extra, a real person. Don't buy from an insurance company with an 800 number and a voicemail menu. Auto Owners Insurance operates exclusively through local independent agencies here to help you with all your insurance needs 24/7. Now that's a good policy. This is Ed Bynum with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
This is Brooke Luce, Admissions Director with Sumter East Health and Rehabilitation. Our primary location is at 975 Miller Road in Sumter. We offer short-term rehab and long-term care. Our specialty physicians and rehab team will work in partnership with your physician to design a rehab program geared towards your specific needs, including chronic weakness, reducing pain, chronic wounds, stroke rehab, and much more. For more information, please call Brooke Luce at 803-840-7515.
Now back to Medical Forum, presented by At Your Service Home Care on WDXY, 1240 AM and 105.9 FM.
Welcome back. I'm your moderator, Jeff Reed. This is Medical Forum. We meet here on every Saturday morning from 10 to 11. Talk about medical issues, anything from hospice, home health.
Tailgate before the USC.
Tailgate before the USC game. And then, of course, we come back and cry after it. But hopefully not this weekend.
Not this weekend.
Central
right?
Florida will go down by a lot.
HBC will have it covered.
You got
promise.
it? I like it. Well, how about Nunez?
Yeah.
I mean, might as well talk a little football. It is the fall,
well,
but I think we're getting a pass.
They can't redshirt him, so let's just put him in.
Right. I like it. And Carson deserves the start.
I agree.
Very good. And we are here with Medical Services of America. Tina, I know more football than any other girl in the medical business. So not only does she handle resource links, she is a huge Gamecock fan. Now, I will talk about another Gamecock fan, and it's Karen Schwartz, even though she is a Clemson fan. But I think that she's bipartisan because we're going to plug her show. She will be on next week. We love Bynum Insurance. We always encourage people to stay local, and there's no better insurance company. And with the re-enrollment with Medicare coming up and Obamacare and Affordable Care Act, blah, 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 we've learned from Karen in the past, do not try to do it on your own. She can save you money. Go see her and all the great staff at Bynum, 469-3030. Check them on the web, www.bynuminsurance.com, or just drop by at 1170 Wilson Hall Road. Very convenient. Look for the big thermometer, the big sign, Chris.
Wilson
that has
Hall,
the clock.
Wilson Hall Road
has the clock.
and
Yes,
Carter Road.
Yes. And it keeps saying 95 even though we're in September. Hopefully this weekend. Now we've had some rain, so hopefully we'll be good. But Tina, we talked about resource links and all the great things you do and all the necessity you have because all the changing Medicare and the paperwork and everything else. Let's talk about the parent company, Medical Services of America, out of Lexington. Pretty cool.
Yeah, 42 years in business. A privately held company right in the heart of Lexington. And we've grown the company from a cardiac company for Holter monitors and to what you see now, which is the full gamut. We want to be the total home health care provider. But it is an honor to work for a company where the owners of the company still come to work every single day.
Mm-hmm.
They do. And if I need a question answered or, hey, can we do this? Or I see a need here, in our community and we need to be a part of this. They're there and they're supportive. So I'm very honored to work with Medical Services of America. We do golf tournaments every year. We've gotten into that. We have our own hospice foundation as well.
Talk to us about that.
We started it probably 10 years ago. We started doing golf tournaments for local charities. We partnered with South Carolina Internal Medicine and with South Carolina Oncology Associates and did their 2 tournaments. And then we said, you know what, we're so good at doing these tournaments, let's do our own. So we decided this past May to do them. And this past May, we raised $45,000.
Wow.
We did 100% of all the proceeds. Everything is volunteered. We did the Kinsley Fuller Scholarship Fund last year for the Medical University. We raised $38,000 for that one. So it's just growing every single time we do it, and it's such a great time. We have a ball. We have great gifts, good Gamecock memorabilia, all kinds of cool
Chris.
Sporting stuff, great trips. So every year, so we use it. We're going to try to do it in April if it doesn't, mess with the Masters week. So
they might have to cancel the Masters.
You're
That's how big this is.
You're playing in the Masters this year, right, Jeff? So
yeah.
You might not be available for it.
You know what? There might be one of the 2 tournaments I'll make, and I'll tell you what. I'm going to go out on a limb. If it is the same time as the Masters, I will forgo the Masters to play your tournament. All right. That's how big it is. That's how well they do it.
We do a great job.
Okay.
We really do. But yeah, we wouldn't do it. Yeah,
I think
it's
great.
Around that time.
Well, that's
getting geared up for the Masters.
That's a huge amount of money. Congratulations. And, we talk about Toomey here doing so many things nonprofit-wise, and your foundation, very much like the Toomey Foundation. They not only put on a great show, have fun doing it.
Oh, yeah.
Very successful, but who wins? Your hospice patients,
Absolutely.
and that's just tremendous. Now, so MSA been around a long time. You still got the guys coming in who started. They're working. They're great liaisons. We were talking hospice last week, Chris, and I know that's something that you're near and dear to your heart. MSA offers hospice here in town.
Yes, Tri-County Hospice Care Tri-County is our local entity, and we've probably been here 20 years or more.
Right off Tahoe Road?
We actually were, us and Palmetto Hospice from Palmetto Home Health and the affiliate there were the first 2 hospices to ever open. And now we have how many? 19 in just the Sumter area.
I had a disclaimer last week because we did have on. I feel that there's 3 or 4 excellent. And if someone wants to email me or call me, I'll be more than happy to echo those. I will not say them on the air. Obviously, you're one of them, and Timmy's one of them, so that only leaves maybe 1 or 2 others. But and that's not to criticize the other people. It's to say this. Do your research, and the evidence will be there. How many years have you been doing hospice? 20 years.
Yeah.
Come on, and one of the first two here.
Yeah.
And I think that Dr. Marr.
And one of the things we talked about last week with hospice and Tri-County does this so well is that they're taking care of the Sumter community. Their nurses live in Sumter. Their administration is right here in Sumter. When there's a problem with the patients, there is a quick response time. It is not a nurse coming from Columbia, for instance, so that the response time is an hour or two. So if the family needs, and we talked about all the resources that hospice provides last week, being a tremendous resource to the family and offloading them in their time of need. And so if the hospice is located in the city that they're taking care of, that's a tremendous difference.
Absolutely. We also, for all of our hospice patients and some of our home health patients with, say, CHF, we have our own help unit, which is like a life alert system, but we own our own call center. So they can push a button every single time they want to. But what happens is if that nurse leaves and they push a button, it automatically, you could set it up and design it any way you want, but it will triage, say, oh, okay, they're on hospice care of Tri-County, or they're with this, they have this disease, and they have someone looking at their information if that patient happened to be left alone. Because there are times that could happen. But it's really, really nice. That's free of charge for as long as they're on service. It gives medication reminders on it, fall detection on it. If something happens with that and they're alerted, it goes into a speaker mode. So if, the patient did fall and they're not answering, or if they don't push a button during their scheduled times to push the button, we're calling them, or we're calling their home health nurse or their hospice nurse to go check.
Well, that was Tina Dinkins with Medical Services of America, and we are coming up on a short break here, and we'll have one more segment, and we'll learn even more about hospice and all the services that Medical Services of America does for us here in Sumter. So we'll be right back.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
This is Brooke Luce, admission instructor with Sumter East Health and Rehabilitation. Our primary location is at 975 Miller Road in Sumter. We offer short-term rehab and long-term care. Our specialty physicians and rehab team will work in partnership with your physician to design a rehab program geared towards your specific needs, including chronic weakness, reducing pain, chronic wounds, stroke rehab, and much more. For more information, please call Brooke Luce at 803-840-7515.
Reliable medical equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street, voted best prosthetic and orthotic business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When your insurance policy comes from us, it comes with something extra, a real person. Don't buy from an insurance company with an 800 number and voicemail menu. Auto Owners Insurance operates exclusively through local independent agencies here to help you with all of your insurance needs 24/7. Now that's good policy. This is Bubba Johnson with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
This is Medical Forum, presented by At Your Service Home Care.
And we're back with Medical Forum. This is our fifth and final segment on this Saturday morning. We'll be off to the USC game after this. Everyone's going to the game tonight?
I'll be watching.
We watch the game. Soccer.
You do have an opportunity. I will just say to possibly go to the game.
I may be able to swing it.
Yes.
And Jeff, you'll be off to the game.
No, I have to go to Atlanta on a prior engagement, but my heart will be in Columbia, South Carolina.
All right, very good.
Yeah,
very good.
And if they need me,
they can always call you and get back.
It's gonna be a bad week.
By the final quarter.
Yes.
Kick that winning field goal.
Yeah, they will need. Oh my goodness. Well, for those joining us, we have Tina Dinkins from Medical Services of America. For those that maybe flipped it from the beginning of
We've covered a lot of topics.
We really have.
We've covered a lot of topics. I dare to say we covered the mobility scooter. I don't want to bring it up again. I don't want anyone in the room to be upset.
But we will.
We have let
but there are
people
still
know.
means to get that.
There are means, but boy, they are tough means.
We've covered a lot of topics. One of the topics, though, Jeff, that we've talked about with multiple different parties is readmission to the hospital.
Right.
How big of a deal is this for everybody? It's a big deal to the patients. Frankly, most of them really don't want to go back. They got out. They
expensive.
They were sick. Even if they have to go back, it's going to cost them time and money, and no one wants to be in the hospital, frankly. But there is definitely a vested interest for hospitals to keep patients out because of some of the new Medicare guidelines. One of the services, though, that MSA provides, and specifically in home health, is their chronic disease pathways. I know of all of these, specifically cardiac, CHF, readmission for CHF is common, very common.
Right. They're the frequent flyers to the hospital. There's so much to manage with these patients that we decided that, we really need to educate the patients. We really need to keep them out of the hospitals because the hospitals were saying, please, let's keep them out of the hospitals. They're compromised. And once they go back into the hospital, like you said, it's bad for them. They're more susceptible to something else in the hospital. So,
absolutely. Pneumonia, for instance.
It is a win-win for everyone. We want to keep them in the home because, we're able to bill Medicare from while they're in the home. The doctors need them, getting well and getting educated. So we do have a complete CHF program that was designed by Christina Smith in our North Carolina area. And it is excellent. We have a whole entire kit that we bring to the home. It includes scales so they can weigh themselves. It includes the help unit that I was telling you about, which gives them medication reminders to weigh themselves, reminders to, what to do. We give them measuring cups. We coach them on certain diets. We give them recipe books. We show them exactly when they need to do what they need to do when they're experiencing every little step of their symptoms that they may be having. There's a laminated sheet that goes through, okay, you're feeling this way. Okay, stop here, call your nurse.
And what's fantastic is oftentimes the patients can't get to the medical office every day.
Right.
They need we as physicians need eyes and ears in the home.
Right.
Now, Tina, do you do this through? Apologize, Chris. Do you do this through home health, hospice, or is this another? Because I know you have a community resource person. We've had Cheryl Fluharty on here before, who I know actively helps these seniors as well.
Right. We do it through our home health.
Okay.
And our hospice, if they are needing some extra education at that point in that stage. But we also, like Chris was saying, we're in the physician practices. We free up so much of their time, and we can actually help these patients understand, hey, let us help you and give you these services because you're in need of it, and we don't want to keep seeing you in here and getting worse. Let's get you better.
And sometimes early detection of these issues and just minor changes in the drug regimen, for instance, can alleviate that readmission to the hospital. Again, keeping those patients in the home, that's where they want to be, that's where they're most comfortable, and that's where they're not being exposed to all of the infections, for instance, that go on in the hospital.
Absolutely.
Well, and what a great ally to the hospitals. As you've mentioned, this has not been the first discussion of readmissions. I know Toomey's very active through the Spark program that they have, which is taking people like yourself, Tina, Dr. Marr, ambulance services, home health, hospice, and coming together as a community. It is actually a community working to see a problem that we have. We have it in Clarendon. We have it in Florence, we have it in Columbia, and we certainly have it here in Sumter on these readmissions that you talk about. And the government is really coming down hard, Tina, on these hospitals, to where if you are discharged, that isn't fair or unfair. They're being discharged from the hospital because we have diagnosed and we have stabilized the condition. And let's take something like diabetes, which, as we all know, it takes a great deal of discipline for the individual to continue to get over the hump with it. And if they fail in that, a lot of times they end right back up in the hospital, whether it's diabetic shock or what have you. Probably unfair for the hospital to have to be penalized for that. But fair gets thrown out the window, right? When we talk about this, so they are being penalized. So they're trying to be proactive, use services like what Medical Services of America have through Tina's program with resource links, educating the people on the front end, using the physicians, Dr. Mars. We've talked about when your patient goes into the hospital and sees the hospitalist, which is now common in every hospital, but then corresponding back to you within a timely fashion, 24 to 48 hours, and getting them, as Tina, you alluded to, the possible medication that they need.
Right. And with diabetic patients, again, that's, a really hard disease to manage. Education is just so important. And when our nurses come in there, we talk about it, because once they get to a certain level, they're going to be having foot infections and neuropathy and other things going on. And if it's not detected and you're not taking care of what you need to take care of, you're going to end up with an amputation. It could just snowball from there. So, again, early education, getting those nurses in there, having someone to call right away and help triage these patients and not just going straight right back to the hospital is what our goal is. And, again, it is a community effort. And if we all work together as a community, we can help solve these problems.
Well, Tina, we have about a minute and a half left. And, we want to thank you for coming in. We want to thank your company for being a tremendous sponsor and ally to our show, Medical Forum. Trying to wrap up an hour show that probably needs 3 hours. So we hope to have you back whenever you can find it in your busy schedule. But Resource Link, again, Tina Dinkins manages that through people here in Sumter and in other physicians' office, helping people stay up with all the ever-changing equipment, policies, Medicare changes. Your MSA coming 47 years. Wow. That speaks volumes right there. As we close, Tina, give everyone out there through the listening area contact information, how to reach you, and we appreciate you in advance. Thank you.
Thank you again, and it's been a pleasure. I've had a lot of fun with you guys. Medical Services of America is located in Lexington, like I said, but if you want to contact me, I have a number that I dedicate to Resource Links. It's 803-201-4094.
You're the best. Thank you, Tina.
Thank you.
Have a great weekend. Go Cox.
Go Cox.